One particular yet super common hormonal imbalance that plagues women is something called estrogen dominance or excesses of estrogen. Hair loss, weak nails, constipation, and headaches are 4 of over 2.5 dozen symptoms that I'm going to cover with you today. Plus, I'm introducing a freebie giveaway on how you can tame and balance your estrogen dominance or excesses of estrogen in your body. Welcome back to my channel. It's Dr. Melissa Gallagher here, a naturopathic physician who is helping you balance your hormones in today's topic. In fact, this is the topic of every Friday's video. This month, we were talking about female hormones. At the heart of those imbalances, there are 3 estrogen levels that are the source of a lot of our angst when it comes to hormonal imbalances. Estrogen influences a lot of body systems like our neurological, our digestive, our reproductive, and even our immune system. Estrogens also impact organs like your liver and your heart, your ovaries and your uterus, as well as soft tissue like your skin and your lymphatic system. So when you have an assortment of symptoms like we're going to talk about today, it can be very overwhelming and it can affect a lot of different parts of your body. I want to cover with you 30 common and super uncommonly known symptoms of estrogen dominance and excesses of estrogen. Now, there's a caveat before we dig into this extensive list. One of the challenges is that you can actually have low estrogen levels and still present with estrogen dominance or excesses of estrogen. The reason behind that is there is an intricate ratio between your estrogen and your progesterone levels. And most of the time, when women have low estrogen and low progesterone, they will still present with symptoms of estrogen dominance and estrogen excesses because that ratio between estrogen and progesterone is skewed. A common symptom of estrogen excesses is weight gain, particularly around the hips and the midsection. This includes the tummy, the flank, and even the upper butt. Bloating, swelling, and even edema are associated with estrogen excesses. Breast tissue changes that include cysts, fibrotic tissue, or fibrocystic breast tissue, density of the breast tissue comes from estrogen excesses. Irregular periods is super common, and this is common for young teens all the way to women going through menopause. Heavy periods are another common sign of excesses of estrogen. Anxiety and panic attacks are super common. Depression goes along with the anxiety and the panic attacks, and a lot of times you will have the two together. Low libido is another symptom. Headaches, migraines, all different types of headaches fall into the category of excesses of estrogen. This is really complex because a lot of women experience hormone-related headaches around PMS or even around ovulation, and it all is about excesses in estrogen and that intricate ratio between estrogen and progesterone. Not only is hair loss a major symptom, but thinning of the hair. And this is one of the problems as women go through perimenopause and menopause, they notice big changes in the scalp. And that also accompanies the changes in estrogen and progesterone levels within their bodies. A super uncommonly known symptom are cold hands and cold feet. If you're having problems finding where your keys are or where your phone is or where your remote is or where your glasses, maybe you're wearing them and you can't remember where you put them, brain fog and even memory loss, like Alzheimer's and even dementia, can be associated with estrogen dominance. Sleep imbalances are super common, particularly when women are waking up in the middle of the night between 1 a.m. and 3 a.m. in the morning. If you're feeling overly exhausted and fatigued and run down, that is an estrogen dominance. History of breast cancer and ovarian cancers, and even precancerous cells where you're being screened for abnormal tissues. Maybe you've had biopsies. This is very common and an occurrence because of the excess of estrogen, particularly these cancers that are fed by excesses of estrogen. Mood swings, not just during PMS, but sometimes all throughout the month. Accompanying that is irritability. Now, ladies, I also want to talk about some of the lady bits experiences. Vaginal dryness, itchiness of the vaginal region, including the vulva, is a common but uncommonly known sign of estrogen dominance. Hot flashes, that is all about the excess of estrogen. Endometrial tissue and changes in the uterine lining. This can be a thickening of the uterine lining, presence of fibroids, polyps, any irregularities and imbalances in the lining, in and outside of the uterus. The culprit is estrogen. This symptom particularly is one that we don't always register as being associated to your estrogen levels, but it is a sluggish, slow digestive process. Particularly, the sluggishness registers and presents as constipation. Constipation, ladies, and this also affects men, when we are constipated, we are not able to cycle out the excesses of estrogen that the liver is breaking down. This becomes really critical to address when we are trying to balance your estrogen levels. Constipation is a leading source behind driving up those imbalances. For all you PCOSers, and I fall in this category, a derivative of PCOS, one of the major derivatives, is estrogen imbalance, as well as ladies that experience any type of ovarian cysts and later ovulation cycles. This gets really complex because that is where that ratio between estrogen and progesterone and that transition, sometimes that transition's delayed by a few days. And so that becomes really critical. Coinciding with this, infertility is a really big factor with estrogen dominance. Sometimes it's infertility of not being able to get pregnant, and then also infertility meaning not able to sustain a pregnancy and having early miscarriages. Severe cramps. Okay, ladies, if you have severe cramps, I want you to make sure you subscribe to this channel, because next week, next Friday, in this theme of hormonal imbalances this month, next week, next Friday, we will be discussing how to resolve painful period cramps. So make sure you tune in. Thyroid imbalance. This is really big, and a big factor behind thyroid imbalance is, in fact, estrogen dominance. As I mentioned before, weak nails on your fingers and your toes have a direct correlation to excesses in estrogen. So gut imbalances are also a factor. This is separate from constipative states that you might experience, and a lot of times the two go hand in hand. Estrogen directly influences IBS and SIBO, as well as other gut-related imbalances. Resolving your estrogen dominance can help ease a lot of those symptoms of those gut imbalances. And if you do experience IBS, I have a link down below and a special New Year coupon code for you to get a special discount on liposomal delivery of colostrum, which is an amazing resource to help heal your gut. So you balance your estrogen by grabbing this download and utilizing the colostrum, and it's going to be amazing. Last and final, acne is a big factor. There's a lot more in terms of hormonal imbalances at play, but a lot of times when you experience acne here, from the corner of your nose all the way down to your ear and down your chin line, those are acne hormone related zones. Now also, we will see imbalances sometimes on the back, the shoulders, and those are variables that are specifically influenced by hormonal imbalances, i.e. estrogen dominance. So my question of the day, ladies, which of these symptoms do you experience or plague you or you want to resolve? I want to hear from you. Your hormone levels are individual and unique, and they're constantly changing. There are a lot of influences and a lot of factors behind your levels. That's why I recommend, at minimum, annually, you get your hormones, your reproductive hormones tested. I have test kits like this here in our clinic that we mail out and offer to patients and individuals like you watching our videos. I'll include some links down below where you can do that in the ease of your home. I encourage you to dig deep and to address the root causes of your estrogen dominance. If you are unsure of how to do that, I'm going to offer this freebie download. Ladies, link down below. This guide that I've put together, it'll get you kicked off on the right start this year to begin to address your estrogen dominance. Again, get tested. That's critical. We need to know our data. The second thing I want to encourage you to do is to subscribe to this channel and make sure you're watching the videos every Friday this month. After all these videos every Friday this month air, I will be opening up a workshop where we will dig into mastering your hormones. We'll talk about estrogen and a whole bunch of other hormones that need to be synchronized and balanced to help you feel optimized and your best self. That will be a workshop that you can register for. There will be a certain number of available seats, if you will, for this online workshop, but make sure you hit that subscribe button, hit the bell so you get notified. Next Friday's video topic about female hormones, we will be discussing how to tame your period cramps. So if you experience really intense cramping, even heavy clotty periods, next Friday, you'll want to tune in. I'm looking forward to putting that video together for you, and I might be including some of your comments that you mentioned below. So thanks for tuning in, and watch for Sunday's video where I'm going to be talking about how to resolve HPV naturally. That's a video you're not going to want to miss, especially if you've had any history of cervical dysplasias or irregular PAPs. I'll see you then, ladies.